Jeff Sych, and I'm a registered psychologist in Edmonton, Alberta. And today, what we've put together is a panel of frontline healthcare workers who are here to participate in a presentation on coping with the stress of COVID-19. It'll give a chance for the panel to ask some questions and to get some clarification or identify some of the themes that those that they work with might be having about how to get through this current pandemic. We are going to divide the slide up into different chapters and break these into about 15-minute segments. And so please select the segment that is of interest or run it from start to finish. What I'm going to ask each person to do is just introduce themselves, and then we'll go into the presentation.
Hi there, my name is Nicole Pereira. I'm a clinical nurse specialist at the PICU at the Stollery Children's Hospital.
Hi, I'm Leanne, and I am the clinical educator in emergency down in Calgary.
Hi, my name's Eric, and I'm a respiratory therapist here at the Misericordia. Currently just in a frontline worker, but in a manager role currently.
Great. Thank you for taking the time out of your day to represent the frontline healthcare workers who have really been looking for some resources and material to help them and their families get through this. And I hope that we meet this need with this video. So today we want to talk about coping with the stress that is unique to frontline healthcare workers as they respond both in their role, but also support their family, their communities through this pandemic. Today, we really have 8 topics, and stress within frontline healthcare workers is unique, and I want to identify what some of those unique aspects are, as well as what we're going through right now as a community, but also in healthcare, is pretty unprecedented in our lifetime anyway. Part of what is really important is identifying what some of the common factors are that increase people's risk to be affected by stress and go into a crisis reaction. So I want to spend some time on that. There is an effect of social isolation as well on healthcare workers. And I thought that to be warned is to be forearmed, and to be able to identify that maybe what social isolation, what the effects are known to have, so that people can counteract those. And then develop some skills for coping with stress during this time. What a lot of people are asking about is, how do we help family members of our healthcare workers or your family members understand the stress and the stress that it brings to them as they support frontline health workers, but also the impact that it has on children and teens. And then finally, how do we support people after the quarantine? Much of this research is available through different organizations, publications, Center for Disease Control in the United States, as well as some research that came out of the SARS pandemic as well. So, healthcare workers have a unique source of stress by the nature of the work that they do that is not unlike those in the public safety field that serve our communities daily. That we call this the general adaptation system, which is that for the general public, what happens is when we go to work, our baseline level of stress follows that blue middle line. And that as something happens in our workday, our body, by setting off an alarm, activates our sympathetic nervous system that allows us to resist the threat or the demand or the stress. And once that threat, demand, or stress goes down, our body resets itself at our level of stress, goes into a period of recovery to return to the baseline. But what's different about stress that our hospital-based staff and public safety personnel go through is that their alarm is going to work. That the level of stress that they need in order to be at work, in order to respond, in order to do their job, in order to stay alert, resides at that yellow line, meaning that they work their entire shift at that yellow line. And when stress or crises or critical incidents go up, what happens is that their level of response goes well beyond that yellow line, and that the goal is to help them bring down that sympathetic response back down to that functional yellow line level, not the baseline that would be similar for the general population or general public at their job, but being able to bring their stress level down to that yellow line so that they can continue working in their role and serving their communities. So that's what's unique to public safety personnel and healthcare workers, is they go to work activating this resistance level, which is also known as the fight, flight, or freeze, also known as stress response, also known as anxiety. Now, what happens when our healthcare workers are exposed to critical incidents, stressful events, is that it does have the potential to affect them psychologically and put them into a state of crisis. And simply put, what happens is that largely individuals prior to a psychological crisis are thought-driven. They think that generates certain feelings or emotions. But after a crisis, what happens is the emotions take over and the ability to think is significantly reduced. So the emotions limit that person's ability to access their normal critical thinking, problem solving, calculating, being able to really function for a period of time in their role. Now, the other question that I get is, how does stress affect performance? And if a person functions well prior to a crisis or stress happening, so that's where that line where point of impact goes across to that number one, they are functioning well, they are getting through the day, they are meeting their demands. What we know is that when a crisis ensues, when there's a disruption between their thinking and their feelings, we start to see a behavioral pattern of disorganization where it's hard to function. It's hard to identify and access our normal and healthy coping strategies. And only through a series of trial and error and time do people return back up to their normal functioning, get stuck at a lower level of functioning. And for some people, there is an improved level of functioning, which we call post-traumatic growth, which we'll talk about later on in the program. So I think that we can all agree that what's really important is that our public safety personnel, healthcare workers, identify the unique aspects of stress so they can mitigate it, so that they can address it, be aware of it, in order to continue to perform their vital role.